David Gray, at the hands of a doctor approved by the General Medical Council, has thrown the national spotlight on how we care for sick people overnight and at weekends. In 2004, GPs were given the chance to stop providing out-of-hours cover, and 9 out of 10 did. That left primary care trusts around the region to plug the gaps with agencies. In our region, there are 14 trusts caring for a total population of just over 6.5 million. The number of doctors on call varies. Milton Keynes, for example, with a population of 250,000, has 1 doctor to provide cover, though 2 others are on call. In Suffolk, it's up to 3 doctors for a population of 600,000. In fact, if you add up all the doctors, we have just 39 available each weekday night, serving our 6.5 million people. Roughly 1 doctor for every 169,000 people. But consider this, health managers reckon there may be as few as 4 calls an hour per million patients during the night, so often this type of cover can cope.
Now, as we heard, the company Take Care Now, which is based in Ipswich, hired Dr. Ubani. We invited them to take part in this programme, but they declined. There is, of course, a big political dimension to this. Our political correspondent, Andrew Sinclair, is at Westminster now.
Stuart, you may remember I was standing here last week talking about MPs' concerns about out-of-hours GP cover across the whole of our region. There is a feeling here that there is something wrong with the system. That's borne out by those figures which you just gave, and many opposition politicians believe that the Ubani case is just the latest example that things need to change.
Well, I just think it exposes horrifying flaws in the system, really. We've relied far too heavily on doctors flying in from overseas for weekend shifts. That's not acceptable. But then we discover, actually, that there's no system to ensure that before registration in this country, we test their skills in English and their competence, and that surely should change.
What we have learnt since 2004 is that although the previous system was not one you could sustain because of its personal, individual demands on GPs, that going to the opposite end and saying, well, GPs have nothing to do with out-of-hours services has been a serious mistake.
Well, the government today was very quick to announce new changes to the out-of-hours GP system. We'll hear from the Health Minister in a moment. But the opposition parties say we've heard all this before. There was a journalist who died a couple of years ago in similar circumstances. There were promises of changes, and yet they never came about. And MPs believe that this is going to turn out to be a big issue in the forthcoming election. They think that in rural areas in particular, a lot of people are very concerned about this.
Andrew, thank you very much.
Well, earlier I spoke to the Health Minister, Mike O'Brien, and asked him what was being done to make sure such a tragedy never happened again. I put it to him that many people were concerned by our reliance on foreign doctors.
What we need to do is make sure that if there is a foreign doctor, a doctor from Europe or anywhere else, that they speak English, they do know the local NHS, they are competent to do the job. Now, the safety nets are in place for this. In this particular case, they had some holes in them, and that's the holes that we got to plug.
But in 2004, the Department of Health let GPs opt out of hours, just losing £6,000 in pay. Now, that's roughly equivalent to 100 hours of work. Wasn't that a bad decision? Because now we've got this mixed lottery system where different places of the country have a different service.
There's a myth about pre-2004 as if it was some halcyon day when everything was done correctly. Actually, there was a national report by David Carson which showed that the system was failing. The GPs were exhausted both during the day and at night because they were doing these call-outs. Very few GPs would want to return to before 2004. What we have now, as the report which was published today by some of the most eminent GPs in the country, what it shows is the system now is better than it was before 2004, but that there are still unacceptable variations.
The system now suits GPs because they don't have to work as many hours, but it doesn't seem to suit the patients.
Well, it doesn't suit patients to have doctors who are unsafe. Either Dr. Ubani-style doctors, or alternatively, as we had before 2004, doctors who are absolutely exhausted during the day, never mind at night. Let me be very clear with you. If I call an out-of-hours doctor to see my child, I want them to speak English. I want them to be competent. I want them to know how the local NHS works. I don't want a dud doctor killing someone in my home any more than I do in the home of Mr. Gray or any of your viewers. We need to make sure this is sorted out. We can do it this year. We can put in place the right mechanisms this year, and that's why the Director of the National Health Service, Sir David Nicholson, has written to every PCT saying, get this sorted out locally now.
How is it that Dr. Ubani is not able to be prosecuted here? I mean, what other line of work allows someone to come and work over here but not be subject to our justice system?
What we've got here, I think, is a very difficult situation, an unacceptable one in many ways, where somebody seems to have deliberately used the legal system in Germany to ensure that they were prosecuted there so they couldn't be prosecuted here. Now, that is very worrying indeed, and how that happened, I think, needs to be looked at, and we'll be talking to the German authorities to find out how this situation arose.
Mr. O'Brien, thank you very much.
Thank you.
The Health Minister speaking to me earlier, and if you've been affected by the out-of-hours service in any way, then do get in touch. You can phone or email through the Look East website.
Jim Bacon is here, which probably means snow on the 5-day forecast.
But not tonight, though. Not tonight. We've got a mild night tonight, a lot of cloud, and the temperatures should hold